Hi guys, welcome to Radiology 365, where we try to cover core radiology from cover to cover. Today we're going to be talking about emphysema. Emphysema is the destruction of alveolar walls resulting in irreversible enlargement of the distal air spaces. Elastase is produced by alveolar macrophages and neutrophils. Both of these are increased in smokers. Elastase is a powerful destructive enzyme which functions in the host defense mechanism, but excess elastase can be highly harmful to the native tissues. Alpha-1 antitrypsin normally neutralizes elastase. Either a surplus of elastase, example in smoking-related emphysema, or insufficient neutralizing enzyme, that is in alpha-1 antitrypsin deficiency, can cause lung destruction and resultant emphysema. Centrilobular emphysema is a smoking-related lung disease. Centrilobular emphysema predominantly affects the upper lobes, like in respiratory bronchiolitis, interstitial lung disease, which is another smoking-related lung disease, as we saw earlier. Centrilobular emphysema primarily affects the center of the secondary pulmonary lobule. All smoking-related lung diseases like respiratory bronchiolitis, interstitial lung disease, discomitive interstitial lung disease, pulmonary Langerhans histiocytosis, and emphysema may be within the same spectrum of disease caused by macrophage-mediated inflammation in reaction to inhaled particles and toxins. We spoke a lot more about these when we're talking about interstitial lung disease. So these images are showing us some centrilobular and paraseptal emphysema. We'll talk about paraseptal emphysema in the next slide. But we see in the coronal image and in this axial CT some centrilobular emphysema. We can see these destructive areas of the lung here centrally and subpleurally, which are the paraseptal ones. The yellow arrows are pointing to the centrilobular ones, and the subpleural ones are what we call the paraseptal ones. So in this image as well, we can see areas of destructive process going on in the lungs here. So to paraseptal emphysema, as we've seen in the previous image, paraseptal emphysema is usually seen in combination with other forms of emphysema. It is also usually smoking related. Paraseptal emphysema is subpleural in location and may predispose to pneumothorax. So this is the same image from previously. You can see the subpleural location of this area of destructive lung process going on. This is not normal lung tissue. It looks cystic and enlarged and destroyed. And if it's breached, you can have pneumothorax from this. Next, we'll talk about pan-acinar or pan-lobar emphysema. Pan-acinar emphysema affects the entire acinus diffusely throughout the lung. The emphysematous changes are usually more severe at the lung bases. Alpha-1 antitrypsin deficiency is the main cause of pan-acinar emphysema. So in this image, we can see this pan-lobar emphysematous change with lower lobe predominance in this case. You can see that the normal lung parenchyma is destroyed mainly, and it's diffuse throughout the lungs bilaterally. This was a case of alpha-1 antitrypsin deficiency. So to summarize, centrilobular emphysema involves lung destruction in the center of the secondary pulmonary lobule. Paraseptal emphysema involves destruction of the lung in the subpleural and paraseptal areas, and panlobular emphysema involves destruction of the lung diffusely. So that brings us to the end of this discussion on emphysema. The next thing we'll talk about would be on the pleura. That is the last discussion we are going to be having on the issue of thoracic imaging. Thank you very much for your attention. If you found value, give it a like, share, leave a comment, and subscribe if you have not subscribed yet. And I'll see you in the next one.